This segment of Delmarva Life is sponsored by For All Seasons Behavioral Health and Rape Crisis Center.
It is a phrase that you want to repeat and remember. No matter what, you matter. For those struggling with chronic depression or suicidal ideation, it's crucial to reinforce the idea that each individual life matters. And there are plenty of valuable resources at hand to help you or someone else that may be contending with these kinds of thoughts. With us this afternoon to share more about those resources, this is Beth Ann Dorman. She's the CEO of For All Seasons Behavioral Health and Rape Crisis Center. So thank you very much for joining us.
Thanks for having me.
Is it getting easier to talk about this topic?
I think we talk about it more.
Yeah.
I would say that the words come a little bit easier, but the subject still hits just as hard.
Difficult. Have you got a theme for this year's Suicide Prevention Month?
So we're coming back to that ask, listen, share, you can help. And really helping people understand their role in the community.
So why, I almost hate to ask this question because the answer seems so obvious. Why do you feel it is so important to share suicide prevention with the community in general?
You know, one of the things that I think about all the time when it comes to the suicide prevention work is we just never know what people are holding.
Right.
You never know what people are going through, and to be able to have a conversation so that folks can have a pathway if they're struggling to say, I need help. And being able to help the community, more importantly, know that if I ask you, are you feeling suicidal? That if you say yes, I'm not afraid of what's next. Because often we hear people say, you want me to ask someone if they're suicidal? What happens if they say yes? I have no idea what to do. And the whole part of our campaign is you don't have to have all the answers. Right. We just have to be connected to resources and understand that you can pass someone to the experts.
And they can have the resources and answers.
Yeah.
So you've got some speakers series coming up. What's going on?
So we're super excited. We have Jeff Thompson. He's a retired NYPD detective. He now does work within our first responder community and the veterans community. But he's going to come and talk about suicide prevention, not just in the first responder and veterans, because what we find is the struggle is the same. Depression, anxiety, not feeling worthy, feeling like you have so much on your plate, and most importantly, not feeling hope. And so Jeff is going to come and really focus on hope. We want to put tools in people's toolboxes.
Right.
We're not going to crank out experts. I gave a presentation last week and I said to everybody, me being here for an hour and a half doesn't allow you to leave the room and say, I'm now a mental health expert. However, you leave the room with more knowledge, more understanding, and the ability to say, I'm going to give this a try. And then we also have Dr. Andrew Moon, who has worked with the DOD and our veterans community and done amazing work across the state.
Yeah. So I think you just touched on some of the reasons for possible suicide ideation. What kind of things can we look for in our family and our friends?
Yeah, you know, just paying attention to how folks are showing up, if there's a difference in presentation, if people are starting to give things away, if people are coming to conversations and not being able to talk about tomorrow or not being able to look to the future, if you're seeing an increase in alcohol and drug intake, so maybe there's some self-medication happening, if you're seeing somebody show up more, maybe they're showing to your house more, maybe they're calling a little bit more, or maybe there's the reverse. Maybe they're pulling back. Sometimes when somebody shows up to your home a couple of times, if it's not their normal pattern, it's because they're craving the ability for you to say, what's going on? And so really kind of paying attention on both of those sides. And most importantly, we want people to understand that the way that symptoms show up for suicide are different for everyone. So not having this cookie cutter image of this is exactly what I'm looking for.
Okay, so let's say that we see some of these things and we ask the tough question. Is everything okay? What's going through your mind? What do we do then? I mean, how do we refer someone to help?
Sure. Yeah, so my number one statement that I share with people all the time is, you don't have to have the exact answer. So we always look for answers when we ask questions.
Right.
Simply saying to someone, I don't even know what to say, but I'm so glad that you shared with me. That can be sort of your blanket statement and say, I'm here and we're going to walk this through together. There's 988, there's 211 across our state and across our country. Our agency has a 24-hour hotline. calling any of our resources. There's mobile crisis, there may be mental health services, any of those helplines, being able to connect and say, here's what I'm dealing with. If it's an acute emergency, you can also call 911 and your law enforcement will help direct you.
Yeah, it's there. It's available.
It is.
Okay, so you got speakers coming up in September.
We do.
How can we find out more about that or For All Seasons?
You can go right to the For All Seasons website. It's For All Seasons, that's F-O-R, allseasonsinc.org. Or you can give us a call at 410-822-1018. We also have a great Facebook page that keeps you posted and updated, which is For All Seasons Behavioral Health and RCC.
Beth Ann Dorman, CEO For All Seasons. As always, thank you for what you bring to share. It's so
Thank you.
important.
Thank you.